Hi there, Mike Ellis Martin again. We're going to be talking about an introduction to pharmaceutical calculations as part of your numeracy strategy for pharmacy. And we're going to talk about why it's important and the reasons behind that. Why do we concentrate on it? Now, there are two things I'd like you to look at. One of them is on Student Central, the BBC report on GP prescribing errors. The link is there. Unfortunately, it won't work in Panopto, so I need to refer you to that link there, but it's quite useful. And the second is the Channel 4 death due to overdose. There is a written article for you to look at on the presentation. So once you've done that, you can come back, we'll talk a bit more about calculations. Okay, so welcome back. We are now going to look at some more reasons for being good at calculations. The first is your pre-registration exam results are based very largely on ability to do calculations, as are your chances in the Oriel system for pre-registration application. And it makes sense because pharmacists are the experts in drugs and in drug doses. So we're going to talk about a scenario that actually happened in a local hospital and get your thoughts on that. So, what was the scenario? First off, we had a young child, a 4-year-old child, rushed to hospital, suffering from very severe acute asthma. By the time she got to hospital, she was in real trouble. She was hardly breathing and was taken straight to A&E resuscitation for life-saving treatment, literally life-saving. And one of those treatments is intravenous salbutamol. An important thing you need to know is that the girl weighed 15 kilograms. So staff have information on giving IV salbutamol. And where does that come from? Basically, that comes from the children's BNF on intravenous salbutamol. And there's a link here. We'll go and have a quick look at the children's BNF so you can see roughly where that comes from. But from that information, we know that the initial dose for a child coming in this situation, high dose, quick dose, is to try and get everything working better. For a child from 2 to 18 years, which obviously includes our 4-year-old, you give 15 micrograms per kilogram as a single dose. And the maximum dose you can give there, however heavy the child, is 250 micrograms. So that's our initial dose. That's the first thing we must do straight away to try and get improvement happening. Following that, we'd set up a continuous intravenous infusion. So this is drug constantly going into the body at a constant rate. And from that children's BNF, we have child from 1 month to 18 years. Again, that would include our 4-year-old. You give 1 to 2 micrograms per kilogram per minute. And the maximum you can give is up to 5 micrograms per minute per kilogram, depending on response. So we can vary the dose slightly depending on how well the patient is doing. That's all very well. That's telling you the dose that you're going to be giving the patient. But the next stage you need to be able to do is actually physically do that. So how do you get 15 micrograms per kilogram into the child? Okay, so what do we know? From the BNF again and from the product itself, we know that for Ventolin solution for IV infusion, which is a product you can purchase, Ventolin is a 5 milligrams in 5 ml solution for continuous infusion. So we know what the strength of the infusion is. It's 5 milligrams in 5 ml. So what we need to do is to dilute that 5 ml to 500 ml with saline solution. This is because we get a 500 ml bag of saline. And what that does, that means that for every milliliter we now have 10 micrograms of salbutamol. Remember that in the Ventolin, we have 5 milligrams in 5 ml. We've diluted that down, so we now have 10 micrograms per ml. Okay, so what happened? The senior doctor in A&E ordered an initial dose of intravenous salbutamol, 225 micrograms on her prescription chart. So as per the children's BNF, that was documented and on the chart by a nurse that had been given. The doctor then ordered a continuous infusion, again as per the instructions in the children's BNF. She wrote the following on the chart: 2 micrograms per kilogram per minute to be given by continuous infusion. So that means we have 30 micrograms per minute, because if she's 15 kilograms, 2 micrograms times 15 is 30. So 30 micrograms per minute. One problem we have in practice is that we have to, again, it's about administering it. So the machine that's used to deliver infusions has to be set at a quantity of milliliters per hour. So we can't directly make a straightforward calculation. We have to calculate how many mils per hour we need to have. And in this case, the nurses had a 1 litre, 1,000 ml infusion bag of saline solution that they needed to use to dilute the salbutamol. What do you do? Okay, so they decided they needed a pharmacist to try and to work out the calculations themselves. Doctors and nurses felt more confident if the on-call pharmacist would help them work out how much to give and how to dilute the infusion. All this time, remember, this little girl is very, very poorly and is deteriorating. Imagine you're the on-call pharmacist at 2:20 in the morning. They contact the on-call pharmacist for help. Imagine if that was you. So what did they do? It's the following calculation they worked out. So the dose, 30 micrograms per minute, or 1800 micrograms per hour, so 30 times 60. Every vial provides 5,000 micrograms. That's it. So a 5 ml vial is 5 milligrams is 5,000 micrograms. It needs to be diluted to 500 ml. So the nurses therefore can add 2 5 ml vials, it's 10 mils, to the 1,000 ml bag, which gives 10,000 micrograms or 10 milligrams of salbutamol. The child needs 1,800 micrograms per hour, and the pump needs to be set in mils per hour. So we've now got to convert the amount of salbutamol we've got to the amount of liquid that's being infused per hour. And the calculation they did was 1,800 over 10,000 times 1,000, which gives us 18 milliliters per hour. So the nurses removed 10 ml from the litre bag. That's to allow for the 10 mils that you're going to be adding of salbutamol, and added the 2 by 5 ml vials. And they need to set the pump to deliver 18 mils per hour, which gives 1,800 micrograms per hour, or 30 micrograms per minute. Question, was that correct? So I want you to go back and have a look at that and see if you can work that out. Remember, that pharmacist that's being woken at 2:20 in the morning to make those calculations could be you. And this is the reason why we need you not just to be able to just about manage to do calculations, but to be very good at them, so that you're confident in the process you follow that will be correct. Okay. Now instead of fairy animals, we're inspirational people. So if anybody can work out who this is, then be pleased to hear your comments.